In 1685, the personal physician of King Louis XIV of France made a decision that would haunt French military history for the next 3 decades. He extracted every tooth in the king's upper jaw. Not because the king had lost them all to decay, though several were severely damaged, but because the physician, following the standard medical practice of the era, believed that the safest approach to persistent dental pain in a patient he could not afford to lose was to remove the source of that pain as completely and permanently as possible. The extraction went wrong. In removing the upper teeth, the physician tore through the floor of the king's sinus cavity, creating a permanent opening between the royal mouth and the royal nasal passage. For the remaining 30 years of his reign, Louis XIV, the Sun King, the absolute monarch of 30 million people, the man who built Versailles as a monument to his own power, could not eat a meal without food entering his nasal cavity and emerging from his nose. He spent 30 years eating in a way that his courtiers were required, by the protocols of royal etiquette, to pretend not to notice. This was the best dental care available to the most powerful man in the world. This was not a medical failure in the exceptional sense. It was a medical failure in the entirely ordinary sense. Because for most of human history, the toothache was not merely a source of pain, it was one of the leading causes of death on Earth. And before this story is over, you will understand how an affliction so universal that virtually every human being who ever lived experienced it, from Egyptian pharaohs to Roman emperors to the soldiers who fought every war in recorded history, was treated for 4,000 years with methods that were, almost without exception, worse than the disease. To understand what dental pain meant before the modern era, you have to strip away every assumption that the word toothache carries today. Today, a toothache is an inconvenience with a solution. It is a phone call, an appointment, an injection of local anesthetic, and an hour in a reclining chair after which the problem no longer exists. The pain is real, but it is bounded, with certainty that it will end. For most of human history, a toothache had no such boundary. It began, a deep, throbbing, relentless percussion behind the face that no position, no distraction, no act of will could silence. It built over days, sometimes weeks, as the underlying infection spread through the pulp of the tooth into the surrounding tissue. It prevented sleep. It prevented eating. It prevented the kind of sustained concentration that any complex task requires. And then, if left untreated, or treated by the methods available, it frequently did something that a modern patient cannot conceive of their toothache doing. It killed them. Dental infection, the bacterial contamination that begins in a cavity and progresses through the root of a tooth into the surrounding bone, does not respect the boundary of the jaw. Left unchecked, it spreads into the soft tissue of the throat, into the floor of the mouth, into the fascial planes of the neck where it can close the airway within hours, into the bloodstream, causing sepsis, into the brain, causing abscess. A toothache, in the pre-antibiotic world, was a potentially lethal condition with a slow fuse and no reliable way to cut it. The archaeological record confirms this with a consistency that is difficult to look at directly. Examination of skulls from virtually every pre-modern population ever studied, Egyptian, Roman, medieval European, pre-Columbian American, shows rates of dental disease so severe and so universal that researchers have concluded tooth decay was the single most widespread chronic health condition in human history. Not plague, not smallpox, not cholera. The toothache. The oldest known dental text in human history is the Ebers Papyrus, written in Egypt around 1550 BC. It contains detailed prescriptions for toothache treatment. They are extraordinary documents, not because they worked, but because of how urgently, how desperately, how creatively they tried. A mixture of cumin, incense, and onion packed into the cavity. Henna leaves ground with honey. Fermented grain paste applied directly to the gum. Incantations recited over the patient while the mixture was applied, because the Egyptian medical tradition did not separate the pharmaceutical from the spiritual, and a toothache severe enough to prevent sleep was severe enough to require divine intervention alongside chemical. None of these worked. Not because the Egyptians were unintelligent, because the problem they were trying to solve, bacterial infection in the pulp of a tooth, required an understanding of microbiology that would not exist for another 3,000 years. They were treating the symptom with everything available to them and missing the cause entirely. The Greeks approached it differently. Hippocrates recommended extraction, the most honest solution available, brutal as it was, and described the use of forceps-like instruments to grip and remove decayed teeth. He also recommended fumigation, burning a mixture of henbane seeds and allowing the patient to inhale the smoke through a funnel directed at the affected tooth. Henbane is a powerful hallucinogen and sedative. As a dental treatment, it did not address the infection. But it is likely, in sufficient quantities, that the patient stopped caring about the toothache for several hours, which may have been the best outcome available. The Romans, with characteristic practicality, developed a range of dental treatments that included lead-based compounds packed into cavities as a primitive filling material, mouthwashes made from urine, and the instruction, found in multiple Roman medical texts, to catch a frog at the full moon, spit into its mouth, ask the frog to carry the toothache away, and release it. This is in the same medical tradition that built the aqueducts. The frog did not work. The urine mouthwash, it turns out, had a limited bacteriostatic effect. Urine contains urea, which can inhibit certain bacterial growth. The Romans stumbled, accidentally, onto something with a marginal chemical basis. They had no idea why. They did not pursue it. And their patients kept dying from their teeth anyway. Medieval Europe inherited the Roman dental tradition, mixed it with Christian theology, and produced something uniquely terrible. The dominant medical theory of the medieval period attributed toothache to a creature, the toothworm, a small worm believed to live inside the tooth and cause pain through its movement. This theory was not medieval superstition layered over classical medicine. It was, in fact, classical medicine. The toothworm hypothesis appears in Sumerian texts from 5000 BC and persisted, essentially unchallenged, in European medical thought until the 17th century. 7,000 years. One wrong answer. 0 corrections. The treatment for the toothworm was not extraction. Extraction was considered dangerous, correctly, given that any wound to the jaw in an era before antiseptic was a potential death sentence from a different direction. Instead, physicians and barber surgeons attempted to fumigate the worm out of the tooth using burning candles, hot wax, and the same henbane smoke that the Greeks had recommended. In wealthier households, a specialist might be called, not a physician who considered dental work beneath his professional dignity, but a barber surgeon whose professional brief included bloodletting, wound management, tooth extraction, and haircuts, often in the same appointment. Barber surgeons pulled teeth with instruments called dental pelicans, a lever device named for the shape of its beak, which gripped the tooth and applied force. The procedure was performed without anesthetic, without sterilization, and without any particular training beyond the experience accumulated from previous extractions, some successful and some catastrophically not. The patient was held down by assistants. Pain was not managed. It was endured. And if the extraction site became infected, which, without antiseptic, it frequently did, the patient had traded a toothache for something considerably more lethal. The figure who begins to resemble a modern dentist does not appear until the 18th century, and he appears, characteristically, in France. Pierre Fauchard, a French surgeon who practiced in Paris in the early 1700s, published a book in 1728 called The Surgeon Dentist, which is now recognized as the founding document of modern dentistry. Fauchard was the first practitioner to systematically describe dental anatomy, catalog diseases of the teeth and gums with clinical precision, and developed instruments and techniques that moved dental practice from the barber's chair towards something approaching medicine. He also conclusively disproved the toothworm theory, not through a dramatic experiment, through the simple, devastating application of a microscope to tooth tissue, which revealed no worm, revealing instead that what had been described as worm damage was the mechanical and chemical erosion of the tooth structure by acids produced by bacteria. He could not yet identify the bacteria. Antony van Leeuwenhoek had seen microorganisms in dental plaque under a microscope in 1683, 45 years before Fauchard published. But the connection between those organisms and the process of decay would not be established for another century. Fauchard understood the mechanism without fully understanding the cause, but he understood enough to know the toothworm was fiction. 7,000 years of wrong answer, ended by a Frenchman with a microscope. The modern dental anesthetic, the thing that separates a visit to the dentist from the full medieval experience, arrived in 1884, when Karl Kohler, a Viennese ophthalmologist, discovered that cocaine, applied topically to tissue, produced complete local anesthesia. Within months, dentists across Europe and America were using cocaine solutions to numb the gum before extraction. For the first time in human history, a tooth could be removed without pain. The reaction from patients who had lived their entire lives with the alternative was not merely relief. It was, by the accounts of practitioners who recorded their patients' responses, something closer to disbelief. Patients who had white-knuckled their way through previous extractions, held down by assistants, biting through leather straps, sat in the chair and felt nothing and could not understand what had happened. Nothing had happened. That was the point. For the first time, nothing had happened. Cocaine was eventually replaced by safer synthetic alternatives. Procaine in 1905, lidocaine in 1943, producing the local anesthetic system that sits, today, in a syringe in every dental office on Earth. The toothache that killed Louis XIV's sinus cavity, that sent Roman emperors to frog-catching rituals at full moon, that drove medieval patients to barber surgeons with pelican clamps and no anesthetic. That toothache is now managed in 45 minutes with a needle so fine that most patients barely feel it enter the gum. The global burden of dental disease today remains staggering. Tooth decay affects roughly 3.5 billion people worldwide, making it the most prevalent health condition on Earth. In low-income countries, where access to dental care remains limited and expensive, the pre-modern reality is not history. It is Tuesday. The distance between the Egyptian scribe packing cumin into his aching tooth at 1550 BC and the person sitting in a modern dental chair in a city with running water and trained practitioners and injectable anesthetic is not a distance measured only in technology. It is measured in pain. In the specific, documented, cross-civilizational, universal human experience of a toothache with no end in sight, a pain so consistent across all of recorded history that you can trace it from the Ebers Papyrus, through the Roman frog ritual, through the medieval toothworm, through the barber surgeon's pelican clamp, to Louis XIV eating soup through his nose for 30 years. The same pain, across 4,000 years, getting the same wrong answers. You will, statistically, have a toothache at some point in your life. You will make a phone call. You will sit in a chair. A needle so small you will barely feel it will make your jaw go numb, and it will be over. You have no idea, none, how long humanity waited for that to be possible.